So hey guys, how are you? I hope you're doing well and welcome to today's class. We're going to be talking about management of normal labor. And with you is Dr. Rudaina Ahmed. I am an MBBS holder from University of Khartoum. I am a registrar of obstetrics and gynecology. I am currently working in Kosti Hospital. I am a teaching assistant in Nabta College, Department of OB-GYN, and I am a candidate for a master's degree in medical education from University of Khartoum. I hope you're all doing well. Okay, so let's get to it. Parts of this talk include, firstly, we're going to have an introduction, followed by some definitions, the aims. We're going to talk about the first stage of labor, the second stage, the third stage, and the fourth stage of labor. Okay, so first of all, the introduction. I want to start it off with a quote from Harriet Harrington, and she said, "Giving birth and being born gives us into the essence of creation, where the human spirit is courageous and bold, and the body is a miracle." I hope this can put you in the context of how both exciting and scary childbirth can get. Okay, so what is labor? Labor is defined as regular, coordinated, painful uterine contractions. They lead to cervical effacement and dilatation. They are associated with Shaw or rupture of membranes. And do you know what Shaw is? Shaw is usually like a discharge. It can be blood stained or colored, and it's the plug that is closing off the cervix, closing off the os of the cervix from communicating between the uterus and the vagina. Alright, so that was the definition of labor. Now we want to get to the definition of normal labor or normal vaginal birth. It is usually a retrospective diagnosis, so you cannot make it while the woman is laboring. You have to make it after the delivery of the baby. And labor must have a spontaneous onset, and the woman or the patient should be low risk, meaning that she does not have any comorbidities. She's not, for example, diabetic, hypertensive. She does not have any cardiac diseases. She does not have preeclampsia or any of that. And the baby should be presenting with his vertex, meaning that it is cephalic, and within cephalic presentation it is the vertex presentation, and the fetus must be term. So preterm and post-term deliveries are not considered normal vaginal deliveries. Okay, again, both mother and the infant have to be well after the delivery. So if of the mother or the baby have any complications following the delivery, it is not considered a normal delivery. Okay, moving on to the stages of labor. We've mentioned them during the contents of this lecture. We said that we have a first stage, second, third, and fourth. Okay, starting off with the first stage, it begins at the onset of labor, and it ends with full dilatation of the cervix. Full dilatation equals 10 centimeters, and you have to not be able to appreciate any of the rims. The second stage of labor begins where the first ended, meaning it starts at full dilatation, and it ends with the expulsion of the fetus. The third stage, it starts with delivery of the child, and it ends with expulsion of the placenta. And the final stage, the fourth stage, is it starts with the expulsion of the placenta, and it ends 1 to 2 hours post-delivery, and in some places you might find it up to 4 hours post-delivery. Alright, so the first stage is the cervical stage. It talks only about the cervix, when the labor starts until the cervix is fully dilated. The second is about the fetus, so it starts with full dilatation until the delivery of the baby. The third is about the placenta, so it starts after the delivery of the baby until the complete delivery of the placenta. And the fourth is about the mother. It starts after the delivery of the placenta and it proceeds up to 4 hours post delivery. And as I said, it's about the mother. We have to ensure that she is well, she is vitally stable, there is no postpartum hemorrhage, and there are no other complications relevant to childbirth.